Well, hi everyone, I'm Judy Elliot here at a great location in Dalton, and I'm with Dr. Carrie Nease. And Dr. Nease, it's great to be back out here with you today.
Well, thanks. We appreciate you coming.
It's been quite a time since we've been here because you've been so busy. It's kind of hard to get you back up in Dalton sometimes, although you're back and forth between here and Calhoun,
Sure, right.
Chattanooga, just different areas.
Right. Yeah, we're expanding, and it's been a busy few months since we've been together, but doing lots of interesting things, developing an office in Chattanooga. I'm working up there actually part-time already over at Grandview Medical Center about every other Friday. But we spend a lot of time here in Dalton and of course in Calhoun, which is right now still our primary location.
Right. And I know that you have developed a website, so people can also go online, and we're showing you the website that people can click on and know more a little bit about your practice.
Definitely. That's the way we tend to try to get information out to our patients or potential patients, is through the internet. And of course that's probably the most common way people find out just about anything these days. But our website, southernsurgicalarts.com, and if you have it up on the screen, you'll see it. But certainly, definitely, if you're interested in learning about what we do, what I can offer, go to the website. There's really tons of information and lots of pictures and hopefully everything that you would need to at least be informed about what we offer, and then you can decide from there if it's something you want to call and come in for a visit.
Right. And any questions about locations, your location, different areas, call the office number that we're giving you, and that way they can kind of give you the best idea from where you're located with your calling, with the callers calling.
Right. Well, even on the website, there's a map for all of our locations, and so it's pretty easy to find. Right.
Now, I know we talked a little bit earlier before we started actually filming this today, but there are a lot of things that are happening in the area of facelifts now.
Yeah, probably one of the most interesting things we can talk about today is laser facial rejuvenation. And this is something I've been doing for about 2 years now. And actually, just almost a year ago, we started a study here, a clinical trial at Southern Surgical Arts. We did 26 patients, women and men, aged 40 to 55. And what we did was a dual laser facial rejuvenation. So I use my smart lipo laser for the jowl area and the neck. And I use a fractional CO2 laser for the face, for the facial skin. So what our goals were to say, well, what can we do with lasers without making any incisions, no stitches, and have downtime of a week or less? And so I took these lasers. I was already using them separately, and I said, well, I think we can combine these two. And there's a few other guys actually in the country who are doing something similar, who have done something similar recently. But in about a 45-minute to 1 hour procedure with no scars and no stitches, we address the jowls, the neck, and the full face for sun damage, wrinkles, jowling, lax skin under here, excess fat here, an overall refreshed look, very natural look. And most women had downtime of about 5 days, had virtually no pain. It's done under local anesthesia with light sedation. And we're following everyone for 6 months, and I'm going to try to get follow-up for a year on most of the patients if we can. And so far, very, very, very good results. Most everyone says they feel like they look a lot younger, more refreshed, not pulled or plastic. So it's a very nice, very, very nice treatment for the right person. Now, if you have a lot of loose skin or really bad jowling, or a little bit older, then you probably need something a little more aggressive, but for the right patient. So most women in the late 30s or early 40s up to probably early 50s, I think it's a really, really neat procedure that I will likely be doing quite a bit in the future.
Right. And how long does that procedure take usually while you're
An hour.
Really?
It's about an hour.
All that in an hour?
And like I said, downtime less than a week.
Yeah.
And results should, I mean, I think, for the women in their 40s who don't need a facelift or don't need a big surgery or don't want to look unnatural, it's a great procedure that I think will push out any bigger procedure for at least a few years, if not, 5, 6, 7 years, in that range.
Very interesting, and I think the point here too is knowing what the patient needs, because sometimes the patient doesn't really know what they need. They know that they need something. They look in their mirror and they're like, well, I wish I had something that just kind of makes me look a little bit more refreshed, a little bit younger. You do a consultation, or they have a consultation?
Definitely.
There?
I mean, that's one thing. You got to just come in, let me look at you, and say, hey, here's what we can accomplish, or you are a good candidate for it, or you're not. In the study, you could not be a smoker, so it had to be non-smoker, had to be 40 to 55 years old and generally healthy. And then you also have to have the right skin type, meaning you have to be relatively fair skin. If you're real dark skin, we can't use the resurfacing laser on you, but we could still potentially use a smart lipo laser on the jowls and the neck for any skin type.
Wow, so if you had this done, then in a couple of days, weeks, you could really look refreshed.
Yeah, most women at a week look really, really good.
Okay.
I mean, I was impressed. I think I got more results than I expected to even.
Yeah.
So
great.
It's neat. So it's a great thing.
Right. I want to talk also about some of the things that you offer other than the face area. Tell me a little bit about some of the other services that you have.
Well, probably the other interesting thing we do is called a mommy makeover, and the target patient here is a woman in the 30s, sometimes 40s, but often in the 30s, who's had children, and the effects that kids have on your body, the breasts and the abdomen especially, they can be very frustrating. You lose a lot of self-confidence, and so things we can do with smart lipo, with a tummy tuck called an abdominoplasty, breast augmentation or lift or a combination. You kind of make over from the neck down, and that's something I do really, really frequently, and probably some of my happiest patients.
Yeah. Now, how do you plan that? Do you plan that? Do you do very many procedures at one time, or
it depends. I mean, that's a good question. Sometimes we combine. Sometimes we'll do a breast and tummy tuck together. Sometimes we'll do the breast separate from the tummy or from smart lipo. Thighs are pretty common to do smart lipo just to recontour the areas. If you're generally young and healthy, then we can often combine the procedures, so you just have one downtime period of 10 or 14 days. So it's very, very rewarding. I have a lot of women come back who say, I feel great about myself. I felt really bad before. I was really uncomfortable with how I looked even in clothes or in a bathing suit, let alone without clothes, without being, when you're exposed, then everything's really out there. So we restore a lot of confidence, and that's great, not only for the woman, but for their relationships and their marriage.
Sure. Now, it brings up another interesting question. Do you also work with men, or is it mostly your women?
Men are probably 5% of my patients, and men usually want smart lipo of the neck. They get a little turkey neck going, and sometimes even at a young age have a little fat pad here that gives them sort of a double chin look. So guys really commonly do here, and then the abdomen and flanks. That's commonplace for men to store a little excess fat. Even if you're generally healthy, you can have a little bit there around the midsection, and so those are the common things we do for guys.
Right. Is the liposuction that you mentioned, does that last for a while? Or?
Oh yeah, I mean, we do smart lipo, so we use this laser-assisted liposuction. And the fat cells that we take away from, say, under the neck, I mean, once we take them out, the laser destroys the fat cells, and we aspirate or remove them with a little fine cannula. Once they're gone, they're gone. If you gain a whole bunch of weight, that could it could come back. But if your weight stays about the same, it's a permanent procedure, meaning many, many years of result.
Right. Sometimes people have problems. Just they look at the stuff like around the eyes. Maybe there's some fine lines in this area. What do you suggest for that?
Well, that's often non-surgical type options. We do chemical peels, laser treatments. The fractional CO2 laser that we mentioned is great for fine lines on the face, where the forehead, or the eyes, around the mouth. A great complement to that would be Botox or Dysport. So another interesting thing going on is we have Dysport now, and Dysport is a competitor for Botox. It works almost identically, made by a different company, so it has a different name.
Right.
But for lines here between the brows, the 11 lines, and then the crow's feet, Dysport and Botox both work really, really well. It's an easy procedure, just a few little bitty needle injections. It's not scary. The creams they try to sell you on TV that are say they're better than Botox, and they show you this huge needle, it's not like that at all. The needle's tiny, and you barely feel it. It takes 5 minutes to do the treatment, and then you get results for somewhere between 4 and 6 months. So Dysport's a great new alternative to Botox, but they both work great.
Well, now I'm thinking here, you know, for people who are maybe thinking about, oh, what would I like to have for the holidays? Hey, gift certificate might be a thought.
Gift certificates are great. Gift certificates are great, especially if it's just for a dollar amount, not for a specific procedure, because then you can come in and say, well, hey, you know, meet with me or my estheticians, my nurses. You know, we do facials and microdermabrasion and laser hair removal, along with, you know, we have skincare products along with the more invasive things that I do surgically and all. But sure, gift certificates are great because you can come in and say, well, here's what bothers me, what do I need, and then you've got something to help cover the cost of it.
Now, do you do the surgery here in Dalton as well as Calhoun, or where do you do your surgical?
Well, surgery is done either in the hospital or in our surgery center down in Calhoun.
Okay.
And here in Dalton, we do everything except surgery. So we do all our med spa services, our esthetician services, our pampering things, as well as Botox, Restylane or fillers for the lips and lines, anything minor, chemical peels, laser treatments, all that, but no surgery.
All right. Now, also, I noticed behind us you have all types of, well, nice, relaxing candles. But you also have makeup, things that also help how the finished look.
Right. Sure. Everything that I do, I mean, I try to have everything be a compliment. And so everyone that comes in doesn't need everything that we do. But if you're having, say, a facelift, well, you need your skin to look pretty and to take away surface sun damage and lines. So the lasers help, but also our skincare products. And, you know, meeting with our estheticians, they can help maintain the results that we might get from a more aggressive treatment. So they'll usually, I mean, not only do things like stay out of the sun, so they'll counsel you on protecting your skin, but also say, well, here's some products that are going to be beneficial for you. You need to get a microdermabrasion every 6 weeks or so is ideal to get the dead skin cells off the surface, give you a pretty polished look. And you know, advice with makeup and all those things too, of course.
I know. And I know we've covered a lot just in the last 13 minutes, but really and truly just take one step at a time.
Yes,
and,
absolutely.
You know, that's how you find what you really want. It's just one step at a time, and get the consultation. Then you kind of know which direction that you're going in.
Look at the website, and then come in and meet with us, and we'll help you try to achieve your goals.
All right. Well, thank you so much. It's been great to be here with you again.
Thank you.
And we thank you for being with us here. I'm Judy Elliot here with Dr. Carrie Nease, and until next time, we hope you have a great day. See you again.
To advertise your business on TV, contact Elliott Media at 706-529-4237.